Hey everybody, it's 12 Soul here. I'm at Sturgess and hanging out with this gentleman here. What's your name, sir?
My name is Paul Opp.
Paul Opp. Now, a little bit about Paul Opp here is that, well, hell, he's an entrepreneur. He's had a logging company. He's done a lot of different things. But right now, he's kind of stuck in America in a way because he's got this business in Peru. Tell us a little bit about that.
I've got a humanitarian organization down in Peru, and in a nutshell, we've got a crisis rescue center for abandoned and abused girls, educational programs for impoverished kids all the way through the university level, and then I have a dental clinic that's doing free dental work 5 days a week for impoverished families, a surgery center, and a medical program.
So how long have you been doing it?
About 20 years.
Wow. So, we got to talking, and we're talking about the COVID, because these are the COVID files,
Yeah.
And he's talking about Peru. You got out just like, what, in March, right?
I got out in March, 24 hours before the country closed.
And they closed the country for a good reason, right?
Yep.
Okay, so, I keep talking about the fact that, America, for the most part, there isn't a lot of COVID in America right now, but what we do see is on the reservations and sometimes in the black community, people are pretty afraid, okay? But over in Peru, this is a different situation. So let's talk about over there in Peru and what's happened and why.
Yeah, so in a nutshell, and I'll just make this concise, we have tens of thousands of people in the impoverished communities there that you would really describe health-wise as the most vulnerable here in the States. For example, here in the States, they're saying, well, you got to keep this virus away from old people and people with respiratory issues and heart issues, and the same population that you would not want to have a severe flu or pneumonia or something like that. But the difference is in Peru, we have tens of thousands of people that are so impoverished that nutrition's bad, their immune systems are compromised, and
more.
And there's no medical backup, for these people. And so what happened in our city, and this is a real paradox for me because I've got some real mixed feelings about how all of COVID has been handled here in the States. It's been so politicized that, anyway, that's a whole other topic.
No, it is. No, it's part of the topic, really.
Right.
But in Peru, it's kind of real.
Yeah, so what happens is here in the States, in my opinion, huge overreaction, knee-jerk thing, here in the States. But the reason it's a paradox for me is that I get down to the city where I've worked for the last 20 years, thousands of people are dying. Just in our city, in our little region, there was over 4,000 people that died. 22 doctors in our city died. Hundreds of healthcare workers either were sick and recovered. Some of them died. I don't have the numbers on those, but these are real numbers. Our hospital systems collapsed. They ran out of oxygen, medicine. The physicians quit coming. Everybody.
You said there were
22 doctors that died.
Wow.
They finally brought in,
and they were so indigenous people, the Peruvian doctors, right?
Late in the game, finally, they brought in a couple plane loads of physicians from Cuba because we had nobody. Our hospitals were closed. And anyway, a lot of stuff happened, but the morgues got swamped and shut down. There were bodies stacked up in garbage bags because there was nobody working at the morgues. Everybody was home trying to isolate because people were dying left and right. People were so finally they dug a big mass grave out on the edge of town and were dumping bodies in it. So on one hand, this city that I've been a part of for 20 years is being devastated by the coronavirus. On the other hand, I'm here in the States and I'm like,
we're in Sturgess. No one's wearing a mask.
And it's like, Now the reality of it is, and we didn't get this far in our conversation, the reality of it is that I believe my wife and I both had COVID because she was down there with me in February and March. We came back, I coughed for 2 months solid, dry cough, didn't produce anything.
Right.
I felt bad for a total of 3 months. So the rest of March, April, May, and finally in June, I started feeling better. We had a little bit of the fever and stuff, but it was not,
Okay, so we're hanging out. We're talking about a correlation between nutrition and the immune system, and then this thing possibly, just like the blankets with the Native Americans so many years ago, a lack of immunity because of indigenous genetics, right?
Right.
So, but that's why I wanted to do this one, because I'm like, My goodness gracious.
So yeah,
This is a new one.
I recoil when I hear people here in the States going, this entire COVID thing is a hoax. Because it's not a hoax. I mean, it killed thousands of people in my city. I know people. One of my volunteers, long-term volunteers, came down many times over the years when he was teenagers, young adult. He finally married a local Peruvian gal. Both of her parents died on the same day from COVID. So I mean, it's the real deal. I know people. I know people that were in their 30s that died of COVID down there. So this is not a friend of a friend of a friend told me that my mailman's neighbor, had it's not one of those. I mean, I know people that have died. My staff know people that have died. And so it's the real deal. So on one hand, I've seen the devastation that it causes in a population that is really vulnerable. On the other hand, I've seen how politicized it is here in the States. And so I've got this heart torn, on both ideologies.
Well, okay, so there apparently I've seen some articles that a lot of businesses. My analysis here has been a lot of businesses have shut down. Okay, a lot of businesses have shut down.
Yeah.
Okay, how will they recover? We don't know. But if you keep people indoors, you have masks on their face, which they're rebreathing their own air, and they're having issues with that. You're not getting the nutrition that you need. Yeah, you're probably going to be at risk.
Yeah, well, I mean, in the nursing homes and the people with chronic respiratory issues and things like that, absolutely, they're at risk, because that's describing a massive amount of people in a developing country.
But on the other hand, you guys, okay, there has been at least 270,000 people here, okay, and if there was something like that going on, masks or no masks, okay, first of all, they don't do any protection. But the thing is, if there was something in the air, we'd have people dead in the streets right now. Well, we'd have mass graves just right now.
And here's the thing. I mean, and then you get into the whole politics of it, and that's not really my forte. But if the virus is not deadly for mass crowds that are rioting, then how is the virus deadly for people gathering at Sturgess or any other thing?
Exactly.
How can I not go to church, but I can riot and protest shoulder to shoulder in the streets? So that's the part that that makes me nuts.
Yeah, right. The next interview that I have is with the lady that was out of Minnesota, and they were talking about putting bricks on the ground. And she's living in Minnesota. I asked her, what did you think about these riots? She goes, listen, Minnesotans, they don't burn, and this was over the Floyd thing, right?
Yeah.
They don't burn their own cities down.
Yeah. Why would you?
No. So,
Yeah.
God.
Oh,
okay.
yeah.
So yeah. So this is it. This is the interview. I just thought this is really cool because, cool, whatever. It's tragic.
It's tragic.
It is tragic, but it's an anomaly to what I've been doing across the United States, because I have not seen anybody that's been sick.
Yeah.
I've asked hundreds of people, anybody that's died? They go, no.
When I have the opportunity at some point, I'll do an antibody test. But my wife and I, we followed our symptoms. We paralleled each other. She was about a week ahead of me, everything she was experiencing, and I was right behind her in it. And it followed the same pattern. And I'm sure as a world that I'm healthy as a horse. I have never been sick for 3 months before.
Right.
Never. And this was like, I was sick enough that I didn't feel good. I coughed, but it wasn't sick enough to keep me down. So I was still up doing everything I was doing.
Right.
But I just felt like crap for 3 months. And then I was better, So I'm sure as a world that.
But unfortunately, the Peruvians, and this is the thing, you were saying poverty, and I've been to the Philippines, I've been to third world nations, okay, in a way. Poverty there, I mean, it's bad.
Yeah.
I mean, you have no idea, America. I mean, seriously, you have no idea what the poverty level in the Philippines or Peru, and you'd think, it's kind of like the way Europeans see Native Americans. They see them on horses, and they're the noble savage, with the teepees. I mean, people still think that's true, okay? And if you think of Peru, you think of all the colorful clothes and all that stuff. But you actually have had a couple of daughters that you.
Yeah, I've got 2 Peruvian daughters.
And they're in the States right now, but you picked them up and they have been living.
Yep.
How old were they?
They were 6 and 8 when their mom died. They were on the streets for 2 years, so they were 8 and 10 when I found them.
And this is the norm, you guys. This is the norm. You know, I mean, seriously, it's the norm over there. So then you have compromised immune systems. You may not get all the nutrition that you need because money buys food. You know, and if you don't have any money, you're just eating scraps. I mean, you're possibly even, you know, in trash bins looking for stuff. So you're gonna get sick. So this, like you said, this thing went through them like a fire. So the recommendation is for Americans is to eat right, be healthy.
Nutrition, can't go wrong with that on any level.
Hey, thank you for this interview,
man,
brother.
you bet.
I really appreciate it.
Thank you, Paul. It was a pleasure to meet you.
12 Soul out. We got another one coming right out of Sturgess. All right, you guys take care.